Men's Health Month, guys. It's super important that we have this time of year. And really what we're trying to do is just bring awareness to some of the common conditions that are affecting men and their health. So when it comes to Men's Health Month, guys, there are always a few things, right? And the few things you want to focus in on are what are some of the causes of death, unfortunately, in men that are common that guys just aren't paying that much attention to. Now, I got to stress, first of all and foremost, it's really important you guys make visits with your doctors. I know you guys don't want to. I know you guys do not want to see your doctor. I know it is not fun. At the Phoenix Men's Health Center, we specifically design our practice for you guys. I mean, it's right there in our name. That's all we do is we only see men focusing on what's important for you guys. Now, let's go ahead and break it down. Some of the things that are going to be important for you guys to be screening for. So number one is going to be cardiovascular disease, right? That's essentially heart disease. Now, heart disease is still the number one killer of men. So the reason it's one of the number one killers, well, it's definitely our diet and it's definitely our lifestyle. So what's happening whenever our diet and lifestyle is not good is a slow, drippy faucet is kind of what I tell people, right? When your faucet is dripping just a little bit, you're not gonna notice anything. But if they're having a problem and it goes for years, it's only going to get worse. And that's essentially what's happening with cardiovascular disease, is that here we have blood vessels, right, that actually feed your heart muscle oxygen and nutrients. So a heart attack is whenever one of these blood vessels gets clogged. Now, there are some major blood vessels here that are more common than others to get clogged. One of the most common is called LAD. It's called your left anterior descending artery. They tend to call this one the widowmaker. And the reason is because of just that, because it's probably the most common spot that guys get heart attacks. Whenever you get a blockage of one of these arteries that feeds the heart, you're basically, wherever that blockage occurs, anything that's below it is going to be starved of oxygen. You give it enough time and that tissue is going to start to die. As soon as this tissue is starved of oxygen, you're going to have signs and symptoms of a heart attack. Now, before you reach this point, usually there's going to be multiple signs before this occurs. Some of the signs are going to start occurring. It could be dizziness, could be a shortness of breath. It could be a mild what's called angina. That's just where you're kind of feeling this general kind of tension in your chest. And then also you're going to notice some things such as like hypertension is going to be one, and also erectile dysfunction. So this is why we always talk about your erections, right? Is because basically your erections kind of give an indication. They're kind of like a barometer as to how well your overall cardiovascular system is doing. When we think about the heart and think about cardiovascular system, you think about your penis and your cardiovascular system, you should really be thinking about your whole body, including your brain. So dementia is also closely tied into cardiovascular system or blood flow. So for Men's Health, what I want you guys to do is be sure you guys get your hearts checked out. Now we have extensive testing we can do here at the practice. So we can do additional blood work that your other doctors won't do. If you're seeing us only as your main doctor and you have any kind of concerns about your heart, you guys be sure you need to mention to us. Now, for all of us here at the practice, when we look at your records, we're going to take this into consideration. So if you guys have any kind of cardiovascular concerns, I really, really encourage you guys to bring it up to us. Because if you bring it up to us, basically what we're going to start to do, we're going to start to go through our checklist of checking. Many of these things are super simple. We have advanced blood work that we do, which is very easy. We can send you guys in for some imaging that is very easy and very inexpensive. And it can help to start giving us data. When it comes to this portion of your heart, you guys, you know this is the most important thing you got going for you. And there's a lot of simple things we can do that really do not cost you very much money. So please bring this up to us. Let's not forget, it's the most vital organ we have in our body.